And as we go into your Tuesday, your actual Christmas day, we're only looking at mostly cloudy skies. We don't have a strong threat of precipitation, only holding out at about 20%. I'm going to throw things over now to Rose Beltz. Hi, Rose.
Hi, Evan. Thank you so much. So I have Greg Lang here from the MultiCare Heart and Vascular Institute. We know cardiac events increase certain times of year, weather patterns, holidays, but specifically this new study, which was really interesting, which caught the eyes of our producers, is that Christmas Eve, we're zeroing in on this high incident of cardiac events. So thank you so much for coming in to talk to our viewers this morning.
Thank you, Rose, for having me. And it was an interesting study in reference to the heart attack risk. And it was a significant increase. If you looked at the study, the line was pretty flat throughout the year, and then all of a sudden there's this big bump on Christmas Eve, and and why is that happening? That's an interesting question, and hopefully we can investigate that today.
Yeah, no, because you were definitely interested on coming on and talking to viewers. So what did they actually do? So let's briefly take us through the study.
So it was 280,000 patients that they looked at over about a 15-year period, and it took place in Sweden, and they were very precise on to the minute of when their symptoms started, and so they could then look at that data to determine what is the highest risk both during the year. So they looked at 365 days and where's the highest risks, and do they occur more on holidays such as Christmas or New Year's, or in Sweden they call it their midsummer holiday. But they also looked at then the 7 days of the week. Is there a week that seems to have more heart attacks statistically than other days? And then they actually looked at time of day to see if there's more heart attacks at a specific time of day. So it was
a pretty in-depth study.
Very, and the fact that they had 280,000 patients that they looked at over 15 years, it's a pretty good powered study. So the data, I think, is pretty solid.
Great. So, and what did they find exactly?
What they saw, 37% increase on Christmas Eve than any other day of the year, and specifically they narrowed it down to 10 p.m.
So I find that interesting, that Christmas Eve, because when you think of the holidays, why not New Year's Eve? Because people seem to be...
I don't think they have any direct reason. They can't say because of A, B, and C, but they have some hypotheses. I think possibly it is family versus friends. That's the difference between Christmas Eve and New Year's. I think it also has to do with things that are common to a lot of the holidays. That is the stress that comes with holidays, and Christmas is a big one because of money expenditure. And again, you're with your family. There's a lot of alcohol that is consumed most likely. There's a lot of food that's consumed, and people tend not to move. And so we have a lot of factors that probably play into this.
Gotcha. So with that, but the 10 p.m. was interesting as well. So what is that all about?
I'm not quite sure on that, but I think maybe that's when all of that comes together. People may be ignoring their symptoms, especially coming up to that, because they're so busy shopping, they may not notice or not want to take the time. And then all of a sudden they are overwhelmed with symptoms, and that's when they report or do the 911 call. And I think it's later in the night on that day, most likely because it's the accumulation of everything that's gone on during the day, and now it's over and those symptoms start to present.
Thank you. And so who's mostly at risk here?
It was interesting, and it's kind of obvious, but people that are elderly, so over the age of 75, seem to be more frequent there. People that have a past history of coronary disease. And then one of the biggest concerns in our clinic is the risk or the comorbidity of diabetes. It dramatically increases your risk for cardiovascular disease. So those three factors, age, previous history, and diabetes, seem to be the highest groups that were affected.
Interesting. So with that, can we just point out the differences between men and women, some symptoms that people can look for?
And Rose, there is a significant difference between men and women. Men seem to present the more classical way with exertional chest pain. They're out shoveling, they get chest pain, they stop, it goes away. They're walking a flight of stairs, they get chest pain, they rest, and it goes away. Women, on the other hand, they're more subtle. The 3 biggest symptoms for women that they have some serious problems is significant shortness of breath. That means they may be walking to their mailbox or out on their normal walk and they can't finish their walk because they become short of breath. General fatigue and sleeplessness. So it's much different than how men present. And that's a big piece of what physicians are trying to kind of learn so that we can identify the early onset of disease in women.
Okay, so real quickly before we wrap, what are some things, if somebody's watching at home and think they're at risk, what can they do?
Well, the biggest thing is, I think, is pay attention to those risk factors. Understand that everybody is at risk, and if you have a family history, that risk is dramatically increased. We are trying to do a preventative clinic in 2019 where we assess those risks so you have a better idea of really what you're dealing with. But as people are at home, I think the biggest thing that they can do is stay active.
Great. Thank you so much for your time. A lot of really valuable advice. We're going to jump over Facebook Live because we are out of time to talk a little bit more about this.
Thank you.
But don't go away. You're welcome. We'll be back with more Crime 2 Morning News after the break.